As the pandemic continues to evolve, a lot of us don't know what's next or even just how to handle it. Working for you, WRTV's Nikki DeMentri shows us how the response to COVID is changing in one of Indy's largest suburbs, and an expert weighs in on what a second booster means for the average Hoosier.
It's the last day for Nurse Ann Nix at the Fisher's mass vaccination site.
It's been slower, but that's a good thing.
She's been here since the start.
It's a good thing because it just, I feel like we've gotten this pandemic under control. There might be another wave, who knows, and I'll be here to help if they need me.
By the end of the week, the old marsh at 116th and Brooks School Road will be empty again as the vaccination site moves down the road. The reason? Low demand for vaccines.
No, now we're at the end.
Yeah.
I mean, how does that feel?
You know, it's bittersweet because I think this gave us so much hope.
Still, upwards of 50 people a day are coming to get vaccinated.
I'll definitely get through this today.
And folks came Tuesday asking for a fourth shot after the news of the FDA and later the CDC recommended a second booster for those over 50 and additional immunocompromised groups.
We opened at noon, and at 12:01 we had our first person asking if they could get their fourth dose.
This is a recognition that the data continue to show that the boosters are highly effective at keeping people out of the hospital and keeping them from dying.
Dr. Brian Dixon with the Regan Street Institute says this news shows the administration is taking a proactive step when it comes to vaccines.
The conversation's best had with the doctor if you're in one of the high-risk groups, and if you received the third dose already, you still have quite a bit of good protection, so you may not need to run out and get it right away.
The hope here, he says, is to have a part of the population best protected before another wave may happen.
There's a lot of messages out right now about the vaccine. It can be confusing. It can be overwhelming. What should people take away from all of this?
So the vaccines are safe, the vaccines are effective, and they are the best form of protection that we have against severe forms of COVID-19.
As for the Fishers Health Department, well, they're preparing to administer the second booster dose and will continue to administer them even after the move.
Yeah, more than 95,000 vaccines. We're really proud of the work that we've done.
Working for you, Nikki DeMentri, WRTV.
It may be soon that children younger than 5, including babies, could receive a COVID vaccine. Nikki spoke to Dr. Brian Dixon with Regan Street Institute about what parents can expect.
No, we're still waiting on kids, 5 and under, and all that fun stuff that goes with vaccines. I know you also don't have a crystal ball, but just for an update for parents, what should they be looking out for? I mean, sort of what's next for those kids 5 and under right now?
Yeah, so Moderna just applied to have its vaccine approved for 5 and under. So I think that that's something that we could look at the FDA making a ruling on here in the next couple of months. Probably those vaccines won't be approved or recommended until summertime would be my guess. So it's hard to tell exactly, but we're still probably a couple months away before those younger kids would have access to the vaccines.
And data from the Indiana Department of Health shows 212 new COVID cases in the state. That is down from 228 new cases from last Tuesday. As of yesterday, 305 people were in Indiana hospitals for COVID-related reasons. That's slightly higher than Sunday's hospitalization numbers, but still lower than what we were seeing this time last week. You can register for a vaccine at any site here in our state through the website ourshot.in.gov or by dialing 211.